Hello everyone, welcome back to the class of pharmacology. My name is Dr. Ali Hassan. In today's lecture, we will be discussing about the loop diuretics. So, the loop diuretics is the group of diuretics that act on the thick ascending loop of Henle and resulting in the increase urine output, increase potassium into the urine, increase sodium into the urine, increase calcium and magnesium loss into the urine. So, what is this loop diuretics and how they work? So, this is our beautiful nephron. Here is juxtamedullary network of capillaries, and here is Bowman capsule, and the here is we have glomerular filtration, which come to the PCT, the proximal convoluted tubule, from where it go to the what is this? This is thin descending loop of Henle. Then we have thin ascending loop. Then we have finally the main area of discussion for today's lecture is thick ascending loop, then early part of DCT, late part of DCT, then we have collecting tubule, and then it will go to the renal pelvis and straight from the ureter and to the our bladder. So we are making this part thick ascending loop big here and explaining how these loop diuretics causes potassium, sodium, magnesium, calcium and water ending up into the urine. So now let's start the topic. We see we have over here the big cell. This is a cell which is present here over here in thick ascending loop. So in the lumen we have over here the GFR, glomerular filtration rate, and we have glomerular filtration over here. From the filtration, there is a channel which is called a sodium potassium 2 chloride transporter. So this transporter channel will pick 2 chloride, 1 sodium and 1 potassium, and take them in. This chloride will move, and this sodium will move into the basolateral surface by sodium chloride co-transporter, and a part of sodium will also move through this sodium and potassium ATPase channel into the cell, and this potassium will also have another area from where it will move to the basolateral membrane is the potassium leaky channel. So this transportation of the potassium and sodium will result in creating a positive potential over here, as they are moving in one direction, potassium and sodium. The positive potential will be created over here. This positive potential will drag this magnesium and calcium and take it to the basolateral membrane through what is this area from where it is taking this calcium and magnesium. It is not a transporter, it is the paracellular space, and this transportation of calcium magnesium is called as paracellular transportation. So now we will discuss about the mechanism of action. The mechanism of action of the loop diuretics is loop diuretics inhibit these channel. The which channel? The potassium sodium 2 chloride channel. So when this channel is inhibited, what will it result? You see here what it will cause. Here this chloride will not be taken by this channel, by this cell. Sodium will not be taken by this cell. Potassium will not be taken by this cell. Magnesium and calcium will not go into the basolateral membrane. So what it will be result? It will decrease intracellular potassium into the cell, decrease back diffusion of potassium from this leaky channel, decrease positive potential over here, which result in decrease absorption of calcium and magnesium. And when sodium is moving to and not absorbing by these cells, it will drag water with it and causing diuresis. So what are the drugs that include in this group? The drugs of this group are furosemide, torsemide, and ethacranic acid. The furosemide and ethacranic acid are the most important drugs over here. So, what are the indications, what are the conditions in which we use these drugs? These drugs are used in acute pulmonary edema. We know in acute pulmonary edema there is accumulation, actually there is an outpouring of the fluid in the lungs. So in this condition we need to get rid of this fluid and take that fluid out of the lungs. So we give this patient loop diuretics. IV loop diuretics are very good for the pulmonary edema. Then heart failure. In heart failure, we know when there is right heart failure, there is and left heart failure, the fluid accumulation in the lungs, then right heart failure, fluid accumulation in the peripheries and causing pitting edema, sacral edema, pedal edema, and we use loop diuretics in heart failure just because of this edema. In hypertension, sometimes we used loop diuretics in hypertension, but the most famous diuretic which is used in hypertension is thiazide diuretics. Remember this point. So, refractory edema, in refractory edemas, we also use loop diuretics. Aniline overdose, as we know, it is secreting some of the cations into the urine. So, in aniline overdose, we will use this diuretics to neutralize them and take them out of the body. And hypercalcemic state, as we know, these loop diuretics will spare calcium, will cause calcium to be lost into the urine. So in hypercalcemic state we will use these diuretics. So what are the side effects? In side effects of the loop diuretic, we have sulfonamide sensitivity. As we know, there is a group of drugs including furosemide and many other drugs which are made up containing sulfa group, and many patients have sensitivity to them and causing allergic reaction. So furosemide can cause sulfonamide hypersensitivity reaction. Hypokalemia and alkalosis. How this side effect being caused? I know you are very wise. My students are very wise. They already know about it. You see, potassium is lost, potassium is losing. So when potassium is losing, we come with hypokalemia, and we know hypokalemia and alkalosis are always come together. Only one exception, and that exception we already have discussed in our previous lecture of carbonic anhydrase inhibitors. When there is carbonic anhydrase enzyme inhibitor side effect, it causes acidosis with hypokalemia. Note that point. So then hypocalcemia, hypomagnesemia, hyperuricemia. Tell me, how does these loop diuretics causes hyperuricemia? Actually, hyperuricemia in this way, when the our loop diuretics actually are the weak acids, and they will compete with our organic acids to be secreted into the urine. So in this way, after this computation, it will result in hyperuricemia, and it is ototoxic. It is toxic for the ears, and ethacranic acid is more toxic than the furosemide. There are some contraindications like aminoglycosides, they increase also ototoxic, so the ototoxicity will be increased. Lithium and loop diuretics are again they compete for clearance, so the clearance of this drug will be decreased. And digoxin, as it is causing the hypokalemia. In hypokalemic state, we know the digoxin excretion will be decreased, so the chances of digoxin toxicity will be enhanced. So I hope you all have already get the point of the loop diuretics, how the mechanism is working over here, what are the indications, side effects, contraindications, what are the drugs including furosemide, ethylenic acid, torsemide. So hope you have enjoyed this lecture. So in next lecture we will be discussing about thiazide diuretics. Stay tuned for the next lecture. Until then, bye bye.